Welcome to the MindSea podcast series, Moving Digital Health. Our guest today is Mahshid Yassaei, founder and CEO of Tali.ai. Mahshid, maybe if you could just briefly describe your background to get started.
Sure. I did my master's in computer science at McGill close to about 10 years ago. I worked for BlackBerry, then a few other companies. And then in 2015, with my co-founder, we started Evenset, which was my first entrepreneurial journey. And Evenset was a software company specialized in building solutions for healthcare and medical industry. So over the years, we worked with a wide range of organizations, from small startups to multi-billion-dollar organizations to government agencies, and we help them build their solutions and take it to the market while being compliant with the solutions with the regulations that apply to their product. And then in 2019, Public Health Agency of Canada, PHAC, posted a challenge on their website, which was how the Taliai's idea and the problem, the pain point that we identified, was basically initiated.
Cool. So even early on, you got into the healthcare industry. Was there any kind of reason or anything that brought you in that direction?
Well, my background in computer science was mostly on cryptography and data security, and my co-founder's PhD was also on biotechnology. And when we were thinking about, my role was a security software developer. So every organization I was responsible for building solution that deals with sensitive information of users. Two obvious use cases for this kind of expertise is financial market and healthcare. Mm-hmm. And when my co-founder and I were thinking, we realized that a specialization in healthcare is specifically meaningful because of this reason, and also that in healthcare, there's always a gap between people on the technology side and people that are deep into the healthcare system. Every side is somewhat intimidated by the other side's expertise. And we thought that if we build a team that's specialized and have years of experience building solutions for this market, this accumulated experience can be super helpful from the product design, market research to product development, identifying all common risks, to testing and validation and all that. And this proved to be the case over the years. As we move forward, every new client was very excited to hear that healthcare is all we do, and we are focused and passionate about what's happening in healthcare. So for that reason, I guess that ended up being a good niche to focus on.
Yeah, very insightful. It always helps to have the niche. So tell me about the early days of Tali. What did that look like when you were first getting started?
Yeah, we were kind of lucky with how Tali was started. As I said, it was through a challenge that PHAC posted. The problem they had was that they spent a lot of time and resources developing evidence-based resources for providers at the point of care. But they were not seeing the type of engagement they were looking for, because it was very time-consuming for providers to find the answer to any specific questions they had. One example was that PHAC spent a lot of time developing and keeping the Canadian immunization guide up to date. So this guide is a 5-chapter book, and it has information about everything around immunization and vaccination that a provider needs in Canada. But it's because it's a long guide. A lot of times providers would just Google their questions or will look through American resources just because it's faster to find the answer that way. So the solution that we proposed to them was a question answering interface where providers would just ask their questions in natural language and get the answer back from their resources. So we did the preliminary research with PHAC on a state-of-the-art NLP algorithms. And we built a prototype and we showed some promising results. So we did even a pilot on COVID-19 content in Alberta. And then when we realized that, yes, this is a pain point for physicians, they are spending a lot of time digging into all sorts of unstructured content at the point of care. That was when we registered Tali as a separate business, and I moved to Tali full-time. Right now, Evenset is being led by a managing director that's amazing and is doing a great job there too.
Awesome. So tell me about the current state of Tali. What are the different challenges? How has it evolved since then?
Yeah, we did a lot of research discovery on other use cases for the language model that we had built. So this language model understands unstructured medical content, and we looked for use cases in the medical space where we are dealing with a lot of unstructured content, and we need a fast access, fast information retrieval engine through that content. And the use case that we have ended up with right now is information retrieval from electronic medical record softwares, EMRs or EHRs. And we have built a partnership with Well Health, which is the largest operator of outpatient clinics in Canada, to integrate Tali with Oscar Pro and provide physicians with a layer on top of their EMR when they can ask questions like, is there a history of diabetes in this patient's family? And you might find a record from like 5 years ago or 6 years ago where a doctor has put a note which says like this patient's mother is dealing with diabetes. And if it was not for a solution like Tali, they would have to go through all these records, many years of notes on a structured text, also the structured text to find the specific piece of information. But we're basically giving them this layer. There are other features as well. They can use voice to scribe their notes into the EMR directly, to ask medical questions like, does citalopram interact with acetaminophen, or what dosage of this medication should I prescribe for this patient, etc. So it's basically an intelligent layer on top of an EMR at the primary care setup to save time for physicians and basically let them spend more face time with their patients and visit more patients at the end of the day.
Yeah, it sounds, quite simple on the surface, but underneath, very complex, right? Like, to me, I'm just thinking of like, okay, well, integrating with an EMR, like, technically that's very difficult. And then natural language processing has, all of its other challenges. So what are some of the technical hurdles you've overcome to connect all that together?
Yeah, you're very right about all the challenges you mentioned. On the technology side of it, question answering from unstructured medical content, unstructured content is basically one of the cutting edge areas of research in NLP. Mm-hmm. Even if you talk to computer scientists that are working on that side. So it's not like a technology that's all over the place. It's not like a mobile app or web app where we know more or less what we're dealing with, or even an IoT device that I think pretty much over the days where we're dealing with technical challenges still. With most areas of AI, specifically in NLP, specifically in question answering from unstructured content, we're still dealing with where do we draw the line, the accuracy line, and how do we deal with cases where the algorithm is not accurate, especially in a medical case. This is very important because of the liabilities that are there. So there are a lot of challenges on the product design side of it to communicate the accuracy of the algorithm, how confident is the algorithm about the answer it's suggesting. But it's a game that has both sides. Like, even if you can save an hour or half an hour of a physician time, that's of great value. Obviously, with time passing, we will have better algorithms, more accurate algorithms, and we can save more of their time. But we realize that even with the accuracies that we can deliver today, physicians that are still interested in having that kind of support. So that's on the technical side. But also, as you mentioned, healthcare is not the easiest in terms of integrating with solutions and getting to the market and all the challenges that are there. But I guess we were lucky to find a great partner like Well Health that were aligned with our vision. That this is a piece of technology that needs to be there, that is the future, and they had the means to support us. So Well Health now has more than, I think, 15,000 physicians in their network, and that will give us a lot of opportunity to develop Tali and perfect it for our initial customers, while we're trying to expand to the rest of the market. So I guess on that side, we're just, I should just say that we're lucky to find a great partner like them.
Yeah. And what does the team look like right now? Obviously, lots of specialists in niche areas to solve all these problems.
Yeah, we are currently a team of 8 people. We have a few NLP scientists in the team, software developers, but also product designers. We are at the seed stage right now, trying to show and validate the time that's being saved in Well Health network, and then expand to other primary care networks.
Interesting. How do you see Tali evolving in the future, the next year, say?
Well, there are a lot of use cases for technology like Tali. Right now, our focus in the next year is to perfect it for physicians. And perfecting it for physicians' time and comfort. But Tali can help and support patients as well in between visits. So especially with chronic conditions, a lot of time patients have a lot of questions about their condition, about the medication they're taking. And they don't want to wait till the next time they see their doctor. So you see a lot of patients just Googling their question, and they're not always armed with the knowledge on how to validate if a resource is evidence-based and trustworthy or not. Whereas we can partner with clinics or with the physicians to provide an interface to Tali where the patients can ask the questions and get the answers from resources that are already vetted by their physician. And the physician will then be synced on what kind of questions, what kind of curiosities they had. And if there is an urgent issue, they can even follow up on that. So there's so many cases, and it's just a long journey, and we need to walk it step by step. But it's a very exciting journey for me.
Yeah. And what about voice? Obviously, when you're talking about conversational UIs, I jump to think, the voice UI is a natural progression from that as well.
Yeah, we are already voice enabled. So there is all the interfaces are available both through the physicians typing their questions or talking to Tali. There are some product design challenges around that as well. We imagine that not a lot of physicians are comfortable asking their questions aloud when the patient is in the room. Sometimes they might want to ask the question or like talk to Tali while they're walking in the hallways from room to room, just checking something quickly. So we're giving them both interfaces, actually.
Amazing. I assumed you had obviously thought about that and come across that use case. Maybe if I could, switch gears a little bit. As a woman entrepreneur, have you ever felt there were additional barriers for you to overcome, during your journey?
I haven't been a male entrepreneur before, so I don't know how's the life for.
Well, being an entrepreneur is hard. It is hard enough,
Yes.
and to break through and have a successful product. So I'm just wondering if you did ever feel that there was other challenges, breaking through, pitching the product or developing those partnerships you needed.
Yeah, well, I do acknowledge that there are the game is not equal for men and women, and the game is not equal for immigrants and non-immigrants, and the native speakers and non-native speakers, and all that. So I have a baggage of all these issues as like being a woman and being an immigrant and all that. So it's, but I have been lucky. I have been surrounded by people that were always happy to help and support me. And I can't really complain, although I do notice, specifically in B2B markets where or when you're raising a fund, basically any areas where you're in a subjective opinion of the buyers or the investors matter. Everybody is obviously subject to some discriminations, mostly unconscious, I would say. I don't think most of the time they're conscious or intentional, but we all have these unconscious biases in our minds, and I think that does have an effect on how difficult you raise your funds or how difficult you can win a business partner, because the other side might not feel confident in trusting you or trusting the quality of the work you're doing as much as they do the work of another person.
Mm-hmm. Yeah, and it's, for my part, we are often hiring new people at MindSea, and frequently the talent pool, there's just not as many female candidates as there is male for computer scientists. And how do we get more women to pursue careers in tech and have that confidence to go after it?
Yeah, I do share the same pain. I do see that there are not enough women computer scientists, and I think the ultimate way is through providing a safe space and inclusive space in tech. I remember that when I first joined my first job after school, I was a little shocked, and I felt like I didn't belong because everybody in our team were like this kind of stereotypical picture of a cool guy with like a hoodie and like a somebody that plays video games, etc. And when you're younger and you are at the beginning of your career, you might feel like a stranger to a space like that if you don't play video games or if you don't act or feel or behave like the rest of the team. So I think diversity, like being inclusive to diversity, is the key, or has been the key for me. But I think it is a pity that we sometimes see a lot of girls being intimidated by the tech space and the computer science and pursuing that in universities. I hope that changes soon.
Yeah, I really hope that we're on the right track to bringing more equality into the workspace in tech for sure.
What strategies do you take to hire more women at your own company?
Yeah, definitely. I'm happy to talk about that. It is a challenge. Oftentimes, we're going through and posting a job to LinkedIn, and we get the candidates to apply to the job, and that's the pool we have to select with. And we base that pool on the merits and don't really pay attention to gender. But when that pool is, mainly male, you're a lot of the times you're going to end up with a male candidate. One thing we have done is try to make the job descriptions less specific, because some research has shown that females are less likely to apply to a job that they're not technically qualified for, or many males will see a list of requirements and qualifications and say, hey, that's not quite me, but I'm going to apply anyway. Females are more likely to say, oh, I don't qualify for that. I'll look for a job that I, check the boxes for. So in that sense, we try to craft our job descriptions to just make the job seem more approachable and less specific in terms of exact years of experience, and also try not to ask for the world or a unicorn for the posting as well. Just try and make it realistic for and talk about the opportunities for learning and development and what it's like to work at MindSea, not just who we're looking for in a dream candidate.
Yeah, that's amazing.
We also work with a great partner that builds a diversity hiring platform. And we've been trying to learn from them as much as possible as well along the way.
What are they called?
It's Matheson.io.
Okay.
So Mahshid, outside your work at Taliai, where do you go to find inspiration or learn about innovation in the health tech industry?
I guess my main source of inspiration is just I follow industry leaders on LinkedIn and Twitter, and I get a lot of inspiration there. They sometimes share their thoughts or share the interesting articles they see, and that has been working pretty well. But aside from that, I have been joining conferences mainly in US and Canada to get updates on the most recent activities in the market. One example is CB Insights Future of Health that happens every year. That has been great. For the past 2 years, they have been running that virtually, but it has been still an amazing gathering of market leaders. In Toronto, locally, we had this community event called Health TO that I used to be very active in. I think they have paused their activities or events during the COVID. I hope they come back live after COVID.
Yeah, we're all looking forward to the post-COVID conference life, I think. Not that I went to a lot of conferences before, but not having been able to go to real in-person conference over the last few years. I'm definitely looking forward to the day we can just kind of go and be in the same room as people and have those kind of chance conversations and learn from people in person that way. Getting back to Tali.ai, what are the main challenges you expect to face in the next year?
I think right now our focus is to build a product that a few physicians will love and will advocate for. That is what you're focusing on. A lot of the risk comes from building the AI engine, the NLP engine that's smart enough that they can provide the kind of support they need. And the other is getting a deep understanding of the real pain point at the point of care, getting a clear picture. How does the current workflow look like? Because we don't want to be a burden on physicians' schedules that are already pretty busy. So I guess I wanted to use the word outsider a little conservatively, because we do have physicians in the co-founding team, etc. But from the point of view of somebody that's not active in the point of care, our challenge is to really get a deep understanding of how many different ways a patient visit goes. We know some physicians will, they usually call it pajama times. They keep their administrative tasks to when they go home, and they start just going through all their administrative tasks, putting things into their EMR, etc. Some other physicians will take the time during the day between visits. Some other do it while the patient is in the room. So really understanding all these use cases and building a product that fits perfectly for what they're looking for, I think that is the main point of focus for us. Scaling and selling, distributing, and all that comes after that when we have that perfect solution.
I'm actually wondering what your day looks like. As a computer scientist, you spend a lot of time developing and writing software code, but leading a company, your day looks very different. So, what does your day-to-day look like now?
Yeah, that is actually a huge regret for me. I loved my days when I had the time to develop code and write good software. That was very pleasant for me. As being a business owner, which has been my life for the past 7 years now, it's a different schedule day to day. Every day is a new challenge. You need to work with a lot of different stakeholders and really lead the vision of the company and be responsible for having enough money into the bank for the rest of the company to operate, and different sorts of challenges, which is interesting. I keep facing new challenges. I have to learn new concepts, new ideas every day, and I love that. But I also do miss the days when I had time to focus for 2-3 hours on a specific technical challenge and write good code and all that.
Yeah, I imagine. My background is actually in UX and design, and I feel the same way that I don't do design anymore like I used to, but certainly love to stick my opinion in there when other people are doing design. So. Yeah. I also think it's like climbing up and down the ladder sometime, as a business leader, you have to, have that high level 10,000 foot view, and you're, thinking about the vision and the direction of the company. And then in the next meeting, you might be getting really into the weeds on some specific problem, whether it's on the finance side or the technical side or HR, and you're just kind of, jumping all over the place. It's tough not to be reactive. I always think, I wish I could spend more time, forward thinking and planning ahead. And then, 7 things come up during the day that you have to deal with.
Yeah. But that's the benefit of being a practitioner, growing to a business leader, because I think, as you mentioned, you understand your business to the deepest level and up, and that is a benefit that not all business owners have. So I guess that's the positive side of it then.
Yes, for sure. And how's the learning curve been for you? Because again, coming out of computer science school, they don't teach you a lot about how to run a business, right?
It has been very ad hoc, and I have learned a lot during the process. Just the incubators that we were part of, I used every chance to take the courses that were being offered in terms of the marketing side, the sales process, the operations side, and all that. Also, we have been blessed to get support from great mentors and advisors that were there for us when we had the specific challenges that we need to deal with. And I have learned so much from the advisors and mentors that we had, that has been really to the point and very timely. Whereas the learning and the education is kind of like a slower, longer term investment that comes in. So a combination of both has been very helpful for us to make this transition from a fully technical role to a business ownership kind of role.
Mm-hmm. Well, you're doing amazing. Tali sounds like a great company and doing some really cool things. Did you have any questions for me while we're here? Or?
I saw that MindSea does a lot of app developments and software development. What is your interest in healthcare? Why are you trying to focus, or what other industries do you focus? I'm curious to know more about that.
Yeah, definitely digital health and health tech is our focus going forward. We've been around for quite a while. But 2007 is when we first started, when the first iPhone and the App Store came out. We were part of that. And over the years, we've developed lots of different apps for different businesses and industries. But several years back, we looked and said, what's the work we really enjoy doing that, people are invested in and feel rewarded by. And it's the work we had done with our partners in health and wellness and fitness that, really struck a chord and kind of aligned with our values. So over the last 3 or 4 years, we've really been, slowly pivoting in that direction, just focusing on, those partnerships with health and wellness clients. And we're actually working on a complete redesign of the website right now, where all of the messaging is going to be, focused on digital health. And increasing our specialization in that industry. So with every partner we work with, every person we hire, we're looking like, how can we, bring new skills and knowledge onto the team to fill our gaps and really own and understand the space, because we're not doctors, we're not medical professionals, but we really know technology both on the mobile side and and web and back end. So we look for that expertise on the medical side with the partners we work with. But the more we bring on new team members that have worked in health tech before at previous positions, or do training with the team about privacy regulations and data security, we continue to level up our specialization in that department. Mahshid, I read an article about you on womenofinfluence.ca, and there's a quote I really liked. It said, "I love where I'm at the intersection of tech and healthcare, building more and more impactful products in this space." So I'm just wondering, what are you most excited about in digital space, health space overall in the next few years?
I'm very excited about the shift to a healthcare system where patients have more agency. I love the line of products that are being built around that basically empower patients through patient education and engagement, through remote monitoring devices. Even all the virtual care solutions are basically there to deliver the care to where the patient is, not where the provider is, which is our current healthcare system. So I think that leads to a healthier population overall. And for that reason, it is a very exciting revolution in the healthcare system to me. And all the different technologies that are being built to, as I said, empower patients to rise up to this new challenge are very exciting. That we have, I know a lot of startups that are working on the remote monitoring side, basically devices that measure some metrics from the body. It could be the ECG signal, it could be the blood pressure, body temperature, and then we'll analyze those measurements to give you updates and help you with early diagnosis, which we know is very effective in preventing more serious issues and chronic conditions to developing, being more serious. So yeah, that is what excites me about the healthcare future.
Yeah, definitely the movement of technology into the home to empower patients to take control and have more agency over their own care is definitely exciting to me as well. So thank you so much, Mahshid, for joining us today. And for anyone listening, if you like this episode, please subscribe to the MindSea newsletter so you'll be notified about future episodes. Thank you so much.
Thank you so much. Have a great day.